Hi guys, Dr. Nick here. So today I just want to talk to you about my initial intake because I do get a lot of questions and I get phone calls asking like what does the process look like, how many appointments do I need, all that kind of stuff. So first and foremost, I want you to understand that because I do work with a lot of complex chronic illness, my goal is to get as much information as I can from the patient. So you're going to realize that I have a lot of handouts and I have a lot of questionnaires, I have a lot of different I actually have a very long intake form, and the reason for that is to get more information because sometimes we do forget. I'm human, I forget an appointment to ask maybe some questions that I should have, but I know that my forms will really go over them, or they'll prompt me to ask more questions in a specific area that I may forget during that first appointment. And usually the first appointment is an hour and a half. We go through as much history as we can because of course I can't know your whole life story within an hour and a half. My goal is to get a good understanding as a starting point. And then after that, of course, we do a physical exam. Once we finish the physical exam, then we go into a HRV, which is heart rate variability, and that gives a baseline of your physical nervous system, that autonomic nervous system. Once we have that baseline, then we have a good understanding of where we're at in terms of the overall kind of next stages of our plan. And then usually I would give something right away if needed to, or what we do, we have the second appointment, and within the second appointment we do a bioresonance assessment, and we do that with the sensitive imago, and it allows us to get more information out of you in terms of the energetic stresses on the body. So it tells us in terms of the organs that are being stressed, possible microbial stresses on the body energetically, and that gears us even more in terms of having a focused plan going forward in terms of strategy, so that we can be more effective in terms of getting you better. And then at that point, of course, we have a more strategic plan that we lay out in terms of short-term versus long-term, and at the same time we'll talk about different in-house therapies that we think will be helpful towards you, and also we'll talk about home therapies that we should be doing. Because so just to summarize, we look at it as 2 appointments overall. The first appointment is more of the understanding of your whole health history and getting a baseline in terms of physical exams and doing your neurological kind of baseline too in terms of HRV. And then the second part is doing a bioresonance scan in order to kind of assess energetic blockages and things of that nature. And then of course, if there's any kind of blood work or any kind of imaging that we need, then we talk about that and we go forth and we do something of that nature if we think it's going to be helpful in terms of determining a plan for you that'll be successful in getting you better. So I hope that helps. I hope that gives you a little bit more clarification in terms of my process. And of course, my process always changes because I try to get better, I try to do more, and when I learn new things, I try to implement them as well as I can into my initial intake, but also in general. So I hope it makes more sense in terms of my process and how I do things, but that's how I work at this moment, but you never know when it might change. So thanks for listening, thanks for watching, continue to follow me by subscribing, so don't forget about that.